Hi everybody, it's July and this month we'll be taking you through reproductive health conditions in youth. Well, reproductive health conditions in youth are health problems or disorders that affect our reproductive organs and our sexual health. There are lots of reproductive health conditions that can affect our health, of which some may include sexually transmitted infections, menstrual disorders, polyendocrine metabolic syndrome, testicular disorders, endometriosis, infertility, HIV, and so on. These conditions are common among young people and can affect anyone. Surprisingly, many people are unaware of these conditions, and even when they are affected, they continue with their daily activities without realizing that something is wrong. That is why I am here today to take you through some of these common reproductive conditions, raise awareness about them, and help us all become mindful of our reproductive health. For this session, I'll be taking you through uterine fibroids. Uterine fibroids are non-cancerous growths that develop in and around the womb. That is also called the uterus. Anyone with a uterus can develop fibroids. They are the most common tumors of the female genital tract and the most common non-cancerous tumors in women. Fibroids usually occur between the ages of 30 and 50 years and are influenced by female hormones, particularly estrogen and progesterone. They are uncommon before the onset of menstruation and tend to shrink after menopause because these hormone levels decline within menopause. It is estimated that 70 to 80% of women will develop fibroids within their lifetime. Fibroids can vary greatly in size and in number. Some are so small that they cannot be seen with the naked eye, while others can grow very large, sometimes as large as a watermelon. They may occur as a single growth or as multiple growths, and in some cases can cause abdominal enlargement, making a woman appear pregnant when she's not. We have types of fibroids, and then these fibroids are classified based on their location within the uterus. So we have intramural fibroids, that's the most common type, growing within the muscular wall of the uterus. And we have the submucosal fibroids, which grow beneath the inner lining of the uterus and bulge into the uterine cavity. We have subserosal fibroids, which grow on the outer surface of the uterus and may extend into the pelvis. We also have pedunculated fibroids, which are attached to the uterus by a stalk or a stem. The exact cause is not fully understood, but several factors increase the risk. That is, being overweight or obese, high blood pressure, diabetes, hormonal influences, especially estrogen and progesterone, I stated that earlier on, certain growth factors within the body. Many women with fibroids may have no symptoms and may not know that they have fibroids. However, some symptoms can occur depending on the size, the number, and the location of the fibroids. And they may include heavy or painful menstrual periods, lower abdominal pain or pelvic pain, lower back pain, pain or discomfort during sexual intercourse, frequent urination, constipation, enlarged abdomen, difficulty getting pregnant, and many others. There are possible complications that can result from this condition if left untreated. Some of them may include iron deficiency anemia due to heavy menstrual bleeding, urinary tract infections, problems with urination, infertility or difficulty conceiving. Well, it's always advisable to see a clinician for you to be assessed and to be diagnosed. Also, treatments depend on the size, the number, the location of the fibroids, and the severity of symptoms. Also, patients' future pregnancy plans. So do also consult the clinician for medical directions on what to do and what not to do when you have these conditions. Well, when you sought medical advice from your clinician, they may take you through some surgical options. That is, procedures that may either preserve the uterus for future fertility, and some of them may not preserve the uterus. Okay, so with those that preserve the uterus, we have myomectomy. That's means removing the fibroids while leaving the uterus intact. It can be performed through hysteroscopy or laparotomy. And also, there are some procedures that do not preserve your fertility, and they include hysterectomy, that is removing the uterus, or uterine fibroid embolization, which involves cutting off the blood supply to the fibroids, causing them to shrink. The best treatment option should always be discussed with a healthcare professional and tailored to the individual's needs and reproductive goals. Fibroids are very common, and many women live healthy lives with proper management. If you've experienced heavy menstrual bleeding, pelvic pain, frequent urination, or difficulty getting pregnant, I advise that you seek medical attention, because early diagnosis and treatment can improve your quality of life and help prevent complications. Thank you.